I like to take this as a very light joke. Yeah, that people say veterinarians they eat their patients. Because we consume animals as food products, or keep some as companion animals. So in a way, there are companion diseases that you can actually get from your pet. There's no cure for it. You are beaten and you come down with the amen, write your will, or just pray to God that you're going to meet him.
In the case of animals where they cannot tell you what is wrong, how can you diagnose an animal?
Me becoming a vet has been largely influenced by my dad, because my father, someone that actually liked animals, so he invested heavily into livestock farming and all of that. Even at the peasant level, just that you have animals around. So growing up, I just wanted to be a doctor. Yeah, that was it for me, to be a doctor. If you even trace down to my elementary school books, you'll see I would write Honorable Dr. Justin, Yeah, so I was speaking into the future, speaking my reality, and well, the story is what brought me here. So today I'm actually a veterinarian, courtesy of my dad's huge influence. So at the time I shared my dreams with him that I want to be a doctor. I didn't know so much about veterinary medicine, but he introduced me into it and said, this is still the same thing. You are still saving lives, because at the center of it all we are doing is just to, improve the health of our lives, like our overall well-being as humans. Yes, because we consume animals as food products, we keep some as companion animals. So in a way, there are companion diseases that you can actually get from your pet. We'll speak more on that much later, but it's just to say, at the center of it all, you have to play your part. We ensuring that there's food safety and security on the aspect of animals. That's we're doing our job as frontliners, as veterinarians, as professionals in that regard. We are in turn now helping the human populace to have a more healthy life, a life that is sustained, is prolonged, in good health. Yeah, so that is where, in fact, the concept of One Health was actually bettered. So one can actually function in isolation.
Exactly.
Yes, so I would say that's like the background story for how I became a vet. So for my dad, it was more like, this livestock thing I've been doing, so it's good if you save these guys, because they go through pains as well. They suffer. They can't talk. They can't say it to someone. So for him, it was like, it's more interesting to even save these animals. Thereby, you can even make the owner be more stable and happier, and if their pets are in very good shape, good health, they too will be very happy, and it improves the quality of life that one actually lives. I'm very accomplished and fulfilled to become a veterinarian. So if I have a chance again, I think I'll still choose this profession. So it's good.
I think it's very wholesome that from childhood you figured out what you wanted and you went for it and you got it. Because I know for most other people, the professions that a lot of people are into now, we couldn't even fathom them when we were young. As far as I was concerned, when I was a child, there was no such thing as a podcast or anything
I
like
agree.
that. And to have something for that long in your head and go on to see it to fruition, I can only imagine, how that kind of thing must feel.
Yeah.
But you work with animals, and in the case of animals where they cannot tell you what is wrong, how do you know? How can you diagnose an animal?
Okay. Basically, it's a stepwise process to getting your diagnosis right. So we have 3 forms of diagnosis. So the 3 forms of diagnosis we have, the first one is differential diagnosis. And what happens with differentials? You're basically there are certain unique features that you, the podcast host, has. Okay. Maybe a nice body physique, the way you dress, you actually have a thing for white, stuff like that. So if someone came into the house with your body physique, the way you dress, and something went wrong, people begin to say, okay, the person looked like, coke boy.
Yeah. So
you begin to look at people that live in this area that look like coke boy. They are always on white. On Mondays, if it's them, Monday you won't miss the guy being on white. The other one, black trouser. The difference with the other guy is he looks just like coke boy. He has a white shirt on every Monday, black trousers, but he's always putting on a wristwatch and a face cap. The other person doesn't have a face cap, but has a wristwatch and the other stuff. That is what differential diagnosis is all about.
Okay.
So if I'm trying to investigate a disease process now, I would say, okay, for this one, it comes with fever, it comes with diarrhea, it comes with fatigue, with weakness. So all the diseases that actually fall under that category, I'm going to pen them down under my differential diagnosis.
Okay.
Then the next one is called tentative diagnosis. Tentative now, you're narrowing it down. You narrow it down to the people that have like striking similarities. That it's just one stop that you can use to now separate them. I'm trying to be very basic, so I'm not sounding like I'm talking to a professional that I understand. Yes. Yeah. So when you get to that point, maybe your list of differential, you had like 5 diseases there. You're now able to strike out like 2 or 3.
Yeah.
In fact, to have a very solid tentative diagnosis, you can streamline down to 2. Because at that level, you are ready to treat.
Yeah.
That's for field work.
Okay, field work.
If you go out
field work
for field work and you don't have the luxury of having like a mobile laboratory that you can do confirmatory diagnosis, that's a lab test that will know. At tentative, you can treat and get results. The symptoms that present is the first guiding step.
Okay.
The symptoms. Is there fever? Is the animal stooling?
Right.
Is it weak? Those symptoms communicate to you. But the most accurate form of communication in any functional or living being is actually when you get your samples. Your samples now could be blood, and blood can reveal up to, if not 80%, can give you 80%.
Can narrow it down straight to the disease.
Yes, because everything that happens in your body, one way or the other, is blood that now conveys. Even if a disease process starts, it's when it enters your system, invades. Next thing, your system, So when you get the blood sample, you analyze it. It can tell you a lot of things. If I get your blood sample now, I can know the volume of blood in your body. Something called packed cell volume. I believe some of us have been to the hospital and they did PCV test. You'll be wondering what that means. So just very briefly, you can know that total blood count, white cells, red blood cells, platelets. You can know. Blood will tell you.
From one sample.
Yes, if you get the way they collect the samples is different for each test or procedure you want to do. But the basic thing, the basal thing you need is the blood. So once you get blood and you run your laboratory test, it's going to answer a lot of questions for you. But sometimes now, like I said, in field practice, if you're in the field, you don't have a laboratory by the side, you don't have a mobile one to use, it's the symptoms that are going to guide you. So from what I said, there are certain diseases that present in similar ways. So that first list you are making, let's say on this street now, you just want to gather all the rich people. Our focus, our search is for the wealthiest person. So if you are going to start, you are going to do a census, and first of all, in your differential diagnosis, write all the rich people on this street. You now say, no, they are talking about a billionaire in dollars. But how do you see the account? You now say, okay, the type of cars he drives, the luxury, the investment from what we have. Okay, so that guy's a millionaire, but it's in naira. You strike him out. Like that. Till you now get to, no, Coke boy and his neighbor look like they are the richest, the wealthiest on this street too. So you now stick your neck and say, okay, if it's not Coke boy, it's the other guy. So your confirmatory diagnosis is where the bank or account manager now comes, shows you proof with all the assets. This one now, you're very certain. You know what you're dealing with, you know what you're addressing. So that is what confirmatory diagnosis does. But most times, people operate at tentative.
How long does it take if you're in the field and you don't have the lab? How long does it take if you're using differential or tentative to diagnose an animal? How long does that now take to get what you're looking for in terms of the disease that's affecting the animal?
It comes to the experience. It's just like a toddler when they start walking. That they crawl before. So if you're an experienced person, you can just see this thing and say, no, I'm very sure this is, So, but if you're not so experienced, you're just coming up as a young vet, you would actually definitely have to spend some more time compared to another experienced professional that has handled, and it comes with experience, like I said. if you have managed the case before, once you see it, you don't need to think it's just like it's there. But to be sure, so that you don't expose the animals to what we have now, there's a global trend that we're suffering, antimicrobial resistance, AMR.
That's a disease?
No, it's not a disease.
It's a
antimicrobial resistance is like if you're administering any drug to somebody, it does a particular job.
Okay.
For that. So if you underdose, or you don't take the right measures, or you are just bombarding the stuff, some of these microbes, they mutate. The drug is programmed to go and attack the guy in red.
Yeah.
It has been going there, clearing up the people in red. With time, this guy changes from red to black. So the drug goes in.
Yeah.
But
I can't identify what is supposed to attack.
Yes, for microbes or disease-causing organisms that have this property that I just explained, it's quite difficult to get a vaccine for them because they keep changing. But what I'm saying is, it's wrong and unprofessional to be administering antibiotics indiscriminately. That's why they always advise, don't do self-prescription, don't do self-treatment. If anything is wrong, meet a professional. They will walk you through, they will guide you through, so that you know whatever you're doing, you're being very, very certain you're doing the right thing.
So it means this antimicrobial resistance affects human beings too. It's a general phenomenon that affects living things.
Yes. Have you heard about a scenario where someone is sick, they're taking drugs, but you're not seeing results? That's like one of the perfect examples. So in the past, if the person has actually abused the antibiotics, the disease-causing organism that is in the body has now developed resistance to that drug. So even if you are giving it, it's not going to work. How do I try to explain?
I get it now.
Yes, but basically that's just it. So indiscriminate antibiotic administration is wrong, and it's something that should be condemned. At all fronts, everybody should be involved.
Yeah.
So don't become a doctor overnight. That's why we have different roles, we have different professions. So antimicrobial resistance, AMR, is a very broad topic that if we decide to even pick it up and talk about it, it will be, fertile enough to take us through the course of this session. But I'll just touch on it briefly. So
let me ask something. You said something about, that's why there are different specialists for different things. In vet medicine,
yes,
are there specialists like how in human medicine we have the pediatrician, the gynecologist, and the rest? Do we have specialists in vet medicine that focus on specific types of animals or specific types of whatever?
Yes, we have a lot of specialties in veterinary profession as well. We have oncologists, people that deal with tumor cancers for animals. We have people that are specialists in internal medicine. They diagnose multi-system diseases, basically all of that. Then you have ophthalmologists. Those are specific. Their job is just about eyes, just getting your eyes sorted. We still have dermatologists. Because yes, you would have your pet, and next thing, hair is falling off, alopecia, and then you can actually have another ailment that affects the skin directly. You would see it, all these fungal diseases, they affect animals too. So we have these specialists. We have orthopedic surgeons as well.
For animals?
Yes. It's baffling because the profession is still growing in Nigeria.
Yeah.
For Nigeria, it's still growing.
Yeah, that's why I
so
have this reaction.
In fact, some people have not really actually made sense or made peace with the fact that veterinary services are even important.
Among the oncologists and the other ones, which one best describes you?
Okay, for me, there are so many specialties.
Have you picked a path yet?
Let me just break it down for you a bit. We have people that would specialize in small animal medicine. You could have people that would just specialize in large animal medicine. Small animals, all these small ruminants, goats, sheep, dogs, cats, they all fall under
small
animal medicine. Then you have avian medicine. Avian does basically about birds, poultry. So you can have an avian specialist. Anything that pertains to birds, you call the guy, he comes and he gives you the best. Then you have pathologists. Pathology just basically, forget about the big name, study of abnormality.
Okay.
Physiology is the normal. So you're studying to know the normal function of a particular organ, what it does in the body.
Yeah.
Then pathology comes in when
There's a deviation.
So pathologies are like mechanics.
Right.
When it's functioning well, you just bought the car from the car stand, everything is fine, right? Alternator, this and that, fuel gauge. So by the time your fuel gauge stops working, that's where pathology starts.
Right.
What happened that, led to this thing?
Yeah.
He will come and investigate, and he will not tell you all that happens when a fuel pump stops functioning. The dangers, what you see. So when they come and see all of that. So they help in the diagnosis. So the diagnostic procedure, that's why you have microbiology lab, you have pathology. In most schools, you even have Department of Veterinary Pathology and Microbiology meshed together because they help in disease investigation. So you can have a microbiologist. We have veterinary microbiology.
Veterinary microbiology.
Yes. So these are specialties.
Yeah.
These are specialties.
But it's not studied on its own in unis, right?
At the level of your undergraduate,
Yeah.
you take courses from all these departments.
Okay.
Do you understand?
Yeah.
So when you're done with your first degree, that's you've obtained your DVM, and you want to now go for postgraduate studies. For me, I have interest in pathology. Okay. So I can decide and do my MSc
in pathology.
Yes, in an aspect of pathology. Could be clinical pathology. Could be, so if it's public health, then we have public health. That's the hub that connects humans to animals, So public health are just basically concerned about the quality of food that goes out, food safety, food security, food hygiene, preventing foodborne diseases. So that is what the vet does. But these efforts are not even seen. Yes, well, we are getting our flowers a bit, but they are not really giving that attention yet. They've not been giving that attention to it because the vet every day goes to the abattoir, inspect meats to make sure that the meat that is being sold to people to consume is actually a very good meat. It's healthy, it's safe, it's disease-free.
What kind of diseases can we get from meat that we buy from the abattoir?
Okay, one of them
that you help us prevent.
Okay, from our investigation, you could stop a lot of things. You can see, for example, let's talk about tuberculosis. For example, the TB, any meat that actually, animal rather, that is infected with tuberculosis, and if it's slaughtered, if it's severe, those parts, you are just supposed to condemn all of those things so that nobody eats because it poses a health risk. But the challenge now is our government doesn't even compensate these people. So there are so many terrible things that happen behind the scenes. If you can visit one of the abattoirs, you look at the water they even used to wash the carcass, wash the meat, you'll be shocked. You might never even buy meat from that place again. So the ideal thing is for each animal you inspect at postmortem, there are two forms of meat inspection. You start with antemortem inspection. That is the one you do before it's been slaughtered, before the animal is slaughtered. And after it's slaughtered and the carcass is there, you still examine the carcass. Examining the carcass is postmortem. So postmortem can be to do and ascertain the cause of death.
Okay.
Just the way they call it autopsy for humans. So you do that postmortem, you know the cause that led to the animal's death. It can help you because you definitely see some pathognomonic symptoms, lesions that you can't miss. Pathognomonic just means like this is unique to this particular disease. So when you see like for tuberculosis now, if you're inspecting and you want to actually, once you see an animal that is infected, that was infected before it got slaughtered, you'd see tubercles on the lungs.
Okay, what does the tubercle look like?
Just some protrusion and they're firm.
Like a pimple.
A pimple is not, it's too small. I mean, you could get like very large tubercles.
Okay, so like a swelling.
Good. On it. So you would see it there. So you look out for lymph nodes as well. I believe you all know what lymph nodes are.
Explain lymph nodes.
Lymph nodes, there's a lymphatic system in our body. The body has so many systems.
What does the lymphatic system do?
So what it does, it actually drains all the fluid, the toxic fluid out of the body. So it maintains balance. For people that have like disease like elephantitis, you see how they are big, their legs are swollen.
So it's a malfunction of the lymph nodes.
Yes, the lymph nodes are not working so well because that organism that causes that thing damages the lymph nodes.
Yeah.
If you have a cut or any injury on your leg, you can remember when we used to play football. If you go and play football and then something just happens to your leg, you feel like there's a swelling around your groin.
Groin, yes.
That's the lymph node draining whatever.
Toxin.
Yeah, so when it's engorged, it becomes firm. That's the time you can feel it. If it's not engorged, you will not even feel it. So basically, they do a lot of things, but I want to keep it at a very basal level that we don't get too scientific and people that are watching might get lost. But we have lymph nodes, so you examine those lymph nodes, the ones in the head, neck, chest region, and all of that. If we don't do that inspection, very bad meat will be sold to humans, and they are going to get foodborne diseases that will eventually lead to their death. So the job we do will help humans, will help animals. So I think we're like in the center of what happens, because the humans are the receiving end. The animals, on the other hand, some are for food, some are not. They don't eat some, but we are there to, make sure that the ones that is being taken for food is good for consumption. It's actually fit for consumption. If it's not, we'll condemn, and it doesn't make it to anybody's pot.
How do you get the differences between animals that we eat and the ones we have for companionship? Is there any scientific reason or difference in them that categorizes them like that? Like, why don't we eat cats and keep, say, deer, for example?
Okay, well, I would say it's not really, it has nothing to do with science. It's about cultural upbringing of people. Certain people eat dogs. I think the president of the United States mentioned one time that people in the US are eating dogs, are eating their pet, and there was a lot of outrage. But back home now, this thing happens. We have like certain people here. We can tilt it more to say a particular tribe, but at this point it's decentralized, not just tribe. People eat what they feel. Some people eat snake. I don't know if you've heard of that before.
I have.
Some people eat snake, some people eat rat. So they'll say, the rat they eat. Well, it's different. They have different breeds,
breeds
in it. So the one they eat, for those that eat, they will show you and give you the reasons why is this one that is, they eat it. So people eat frog. That's so it has no scientific correlation to say you're not supposed to eat dog. You're not supposed to eat cat.
Okay.
People eat cat. People eat. It might sound very strange, but people do strange things, So I personally don't eat any of those things I've mentioned. I like to take this as a very light joke. Yeah. That people say veterinarians they eat their patients.
Yeah.
Well, it's not true. A patient is an animal that is presented to you that is sick.
Okay.
That you should address it. And at the beginning of this conversation or session, I mentioned we have food animals. So if an animal is raised specifically for food, that means good. So when it gets to that point where it has to be to serve that purpose, that's what it's going to be. So irrespective of your profession, whether you're a vet, once you're not a vegetarian, you're going to eat the food animal. So it's not like they bring an animal. If they bring an animal to you to treat, then you now kill it and cook. That's when they say you're eating your patient.
Yeah. I have a question that would clarify something for me. Does this mean that every meat is edible as long as it passes certain health checks? Depending on the differences in culture and what people deem fit for eating.
Exactly, that's the point I'm driving at.
So there's no animal that you should not eat.
Once it's not toxic, it's not everything you can eat now.
That's why animal that the meat is actually bad for humans to eat naturally.
Yeah.
Like what?
Even those frog. There's a particular one they eat. If you eat, you die. They have like toxins. It's not every animal that is actually a food animal. But like I said, people try to explore different things. People want to be unique and say, okay, me is this stuff I want to eat. You can't decide for them. So far it's not causing any harm to their body, it's fine. But it's not everything you eat. It's not everything that is actually edible. Not all animals are edible. I would like to think that way. Yeah.
There's this scary disease that when we talk about it in animals, it seems like like a normal animal's disease, but when it touches humans, you're gone. I mean, what do I know? But rabies.
Yeah.
What is the story of rabies, and how do animals catch it in the first place, and then how do we now get it? Can we get it from meat?
You can't get rabies from meat. Rabies is only transmitted in a live infected animal. If you get bitten by a live infected animal, rabies is actually a viral disease. Okay. And it stays in like certain animals are like reservoirs or intermediate host. Intermediate host are those animals, or you are just serving as, okay, let's use, I'm a Christian, so I'm going to say, let's use John the Baptist, for example. He was the forerunner of Christ. So intermediate host, in the body of some of those reservoirs now, or animals that are holding, the disease will not cause any problem. The organism is not going to cause any problem. It might just be there. So it might just be there and not cause any disease. Then it gets to where it has a good ground to, proliferate, cause disease, do all of that. So that's where you have intermediate host, mechanical host. For mechanical host now, there's nothing biologically happening. We have different types of hosts, but the final host is the main host now, is where the disease process happens.
And where you can see symptoms.
That's where you see symptoms and all of that. So basically you can get rabies from bites of dogs, from bats. Bats too, they harbor the rabies virus. So if you are bitten by a bat, you are at the risk of, So, but rabies is incurable. There's no cure for rabies. So rabies is a disease, a viral disease for warm-blooded animals. Once you have blood running in your system, you are vulnerable to rabies.
Is there any way to manage rabies though, if eventually somebody is unfortunate enough to get it?
The cheapest and best way to go around it is prevention, which is through immunoprophylaxis. You vaccinate. So if you vaccinate your pet,
okay.
So you vaccinate your dog, you are helping your neighbor.
But is there human vaccination?
I'll get there. If you vaccinate your dog, your neighbor vaccinates. If the dog now bites anyone out of aggression, like a provoked bite, children coming to play and all of that, you know that the vaccination is up to date. But the next thing to do is, if you see that the vaccination is up to date, you meet a veterinarian, they show you and they ascertain that yes, this animal is vaccinated and is not rabid. They can just manage the wound. They'll manage it like a normal wound till it heals. But if the vaccination status of the animal is unknown, there's what they call post-exposure prophylaxis, So you go and take a shot of the post-exposure. If you are bitten by a dog that you don't know the medical history, you first wash off the wound as first aid, wash it with running water, then you meet a vet, sees that no, this guy is not vaccinated. Next thing, he refers you to a physician, explaining the episode, what happened. You go and get it. So for us professionals that are actually out there working with these animals and are continually exposed to this risk, that's what we take. The vaccination is called pre-exposure vaccine.
Okay.
So you take it if peradventure in the course of discharging your duties as a professional, you get bitten by a dog, you know that you're covered.
So for the layman,
yes,
for the layman that doesn't have to deal with animals every day and also doesn't have access to the pre-exposure vaccine, if they get bitten by,
what you do is post-exposure, before you were exposed to the virus.
Yeah.
Allegedly.
And then I'm asking, I want to know just how definite the situation is. Yeah. If you don't have the post-exposure as well, not everybody has the knowledge.
Yeah.
And so if you don't have the post-exposure and you get bitten, what is the window that you have to say die or for symptoms to start showing? And
for each dog, if you suspect that the dog is rabid, you quarantine that dog.
I asked for human beings, so
I'm with you.
Okay.
For 10 to 14 days, you would see the symptoms manifesting. If you are not certain that this guy, the way he's behaving, I don't understand, and he just beat someone, and it's not a provoked bite. Provoked in the sense that the dog is resting. Somebody came to just do something. That's why. Maybe you're just passing up, and then the guy just moves to go and bite you. I think the common name for rabies is mad dog disease. So the dog, they behave like they are mad. So clearly they are mad because it gets to the brain, does a lot of damage there and all of that. So you want to be sure. So as the dog bites someone, the vet will request for that dog to be quarantined and be under observation. They are going to observe it by the 10th to the 14th. You're supposed to see all the signs. You see them drooling, saliva. You see they're scared of water. They bark aggressively and without stopping. Could bite objects. You just see very strange. It shows. If that comes out, and the only way to confirm this thing is you cut off the head of the animal. That's for laboratory diagnosis now.
Okay.
You cut the head and send it to a lab to carry out all of the tests.
So the test is mainly on the brain?
The brain is...
What are you saying? Is it the head?
Yes, you get the whole head.
Okay.
Yes, and they'll harvest a portion of the brain because I told you the virus is resident there. So you can see it in the inclusion bodies. If you do histopathology, like you do tissue sampling, you do all of that, you're just basically trying to do histological findings. There are certain things you would see once it's rabies. If I begin to point them out, it might not make sense to the viewers, but just know that when the professionals are doing their job, they know how to investigate rabies. But first things first, when that bite happens and you're not sure about the vaccination status of the dog, the first thing you do, you wash off that wound, get a vet informed. They will ask for the dog to be quarantined while you go ahead and take your post-exposure vaccination. Because there's no cure for it. If you calm down, if you are beaten and you calm down with the ailment, it's just how they say now, you write your will, or you just pray to God that you're going to meet him. So it's cheaper to prevent. They vaccinate just once a year that they vaccinate for rabies. Yes, it's a vaccine, anti-rabies vaccine. You just administer and you're covered for that year. They renewed the vaccine, like the vaccination after every year, after every 1 year. Certain clients might go and do more than that, but that's just one of the most serious and life-threatening diseases of public health importance that's ravaging the world today, and is actually a thing of concern, and people need to give more attention to their pets. If you're not ready to own a dog, it's pointless. Don't get any at all. So
the rabies affects cats.
Yeah. Said warm-blooded animals.
So basically,
once there's like blood in your system, and so it stays in the saliva of the animals that actually
infected.
Yes. So if a dog bites you, it's in that saliva. There's no way it's going to create a bite, a puncture, that in the process saliva will not get into this thing. So
the wound doesn't have to be even too deep, as long as there is penetration.
Once there's penetration, and if the animal is rabid.
Have you performed any surgeries yourself on animal, or been in the theater to see?
Yes, okay. I've performed a couple of them.
What kind of surgeries did you?
Okay, there's what is called castration.
Oh.
Yes, and then for the females,
that
procedure is carried out, actually called ovarian hysterectomy, OVH.
So
you remove the ovaries.
Okay.
You are removing the ovaries. That's so that the animal doesn't conceive. It can be by the client's request. There's something you're trying to achieve. Maybe there's disease process that you're suspecting to be in the ovaries, you want to remove it. You can remove. Or you don't want your pet to still be giving birth, you remove it as well. Or it has actually given birth and you think it's okay, it should not continue.
So it's like the equivalent of tying a woman's womb.
Yes.
When you don't want to give birth anymore. There's a myth that obviously all of us know about, that if you castrate a dog, it becomes, not just castrate it, if you cut it off, if you castrate it and give it those organs to eat, it becomes more aggressive and more wicked. Is there any scientific backing to it, or is just normal talk?
No. Temperament has to do with breed.
Okay.
Has to do with breeds of dogs. There are dogs that are very vicious. You could talk of bull mastiff. You talk of pit bulls. They are very aggressive dogs. They are used for security. Each dog breed has their purpose. You could have miniature breeds, these small ones, Chihuahua, all these Eskimos, Lhasas. Those ones, women love them a lot because they're portable to handle. They are just pets that you can sleep on the bed with, you play with them. Then you have these large breeds of dogs that basically all they do, is for security. Some are very good at hunting, So all of that. So, like, the breed actually fits into a particular purpose or an objective or goal. Okay. So when you're trying to own a pet, what do you want to achieve when you want to own a dog now? Let's be specific with dogs now. You want to own a dog that is vicious and, wicked, like the way they say. I think one of the myths, you missed it out, is they'll say if you give it this nono that they sell, this Fulani people, if you allow it to get sour and then you feed it to your dog, it's going to be very wicked. But it's just how you groom the dog. If you bring a dog in the house and you allow it play too much with kids, it's going to grow up to become very friendly. Even these vicious breeds now, psychologically, you can work on them and they will become very docile because you play with them too much, But if you bring it and you isolate it, you bring it out when you want to feed, and at night when there's nobody outside, you bring it. It understands the instincts that they are grooming me for security. So every time they're in the house at night sleeping, that's when I'm out. That means I'm here for patrol, I'm here for mission, something like that. So they'll be more sensitive. So you can train dogs. We have a dog training school in Nigeria. It's located in Jos. This police dog training school. They train dogs there. You can give them commands. They obey, all of that. So it has nothing to do with
cutting and
feeding. And when you castrate, there are certain hormones that are being secreted. In the testicles, all of that, testosterone. In fact, humans too, we have it, right? So that's what actually gives you this masculine, this thing, the deepness of the voice, the if you castrate a dog now, that testosterone that is there, that is going to make it want to go mate with the female and all of that, that's drops. Removed, so it drops. And then you see, that's why you see them become round. They look more feminine.
So if anything, it does the opposite. Castrating a dog does the opposite. It doesn't even make it more aggressive or more masculine, so to speak.
Yes, it doesn't. There's a way it brings it down because it's that guy, that testosterone, is the one that reminds him that you are the alpha male. So when you remove the main plug now, it's just going to be there and not really give you the vibe like a dog that is not castrated or a male animal that is not castrated. So people castrate for different reasons. Could be for fattening.
Okay.
Yes, you could. If you castrate an animal, it actually gains more body weight.
Okay.
Faster than
normal.
Something like that. So you see them, they become so big. So certain farmers do that. Certain animal owners do that. And again, if one of the reasons could be for disease, to prevent disease.
Okay.
Yes. Like in humans now, for male, we'll talk about prostate cancer and all of those things.
Yeah.
One of the ways to even correct that, some people, after you're giving birth, they can just remove so that all of those things don't come and it's settled. But we are not animals, so the preference and the way. But it's just about consent. If you're okay with it, you can do it. So sometimes if your pet now is actually suffering from a particular ailment that has to do with the testicles and all of that, you can just remove it. There's one paraphimosis, I don't know if you've ever seen a penis of a dog come out of the sheet, like.
Yeah.
So all of that. Sometimes it's dogs that have very high libido. Every time
he's always there. He's always
just
out.
trying to, and then maybe it goes and doesn't come back in, and all of that. You try to manage it. It's a condition on its own. Okay. You manage it. It goes back inside. Some people now then during the breeding season, you hear a lot of stories where male dogs will jump the house or exit the house in search of females. They can go as far as so many kilometers away from your house. When they are done with their search and they are chilling, they will come back. So some people now, if you castrate, that guy has no business of living because he has lost interest in the thing that makes him interested in the females now. Is no longer there. So he's just going to focus on the good life, eat and just So, but some still retain those qualities a bit. So even after castration, you can still have some dogs that are very, very aggressive and but in a way there's a way it tones down your temperament that you are forced to become calm.
So if somebody wants to have a pet, because see the pet we like call it the pet industry or however is growing in Nigeria, a lot of people are getting
there's more awareness now.
Even I have cats.
Yes.
So if somebody wants to have a companion animal and you're going to give them a checklist of things that they should have in place before even getting the animal to begin with, things they have to know and have to have, what are those things?
Okay, first things first, you get a comfortable house, like a hutch for a kennel where you're going to keep the dog.
Okay.
That's like good housing. You make all this arrangement before you go and get the pet. So we'll start with housing first. You prepare it. The next thing, when you purchase that animal now, there are standard vaccination schedules that must be followed. In the past, people would just own dogs. It was basically this indigenous breed, this mongrel. They just roam around. Till date, they make jokes about them on Twitter. Ekuke that
the mongrel is their English.
Yes, Ekuke doesn't need any pampering. Once you just leave it, it's going to survive. You will find its way, and But so many things are changing now, and I think we can trace back to the introduction of different strains, all the vaccines that have been given, vaccine failure, and over time, it's frankly impossible now for you to just get a dog and not do anything till he gets old. You have to battle with a lot of diseases in between that are very much preventable, that are not going to stress you. So that's where that vaccination schedule comes in. That's the standard thing to do. Okay. So it's beyond just going to buy a dog. You're going to be responsible. You're going to be spending money for the upkeep to keep them in good shape so that they're not a danger to you and your neighbor. So once a dog is given birth to, at week 6, some people start at week 8, some people start at week 6. So there are 4 weeks in a month. So if you say week 6, that's 1 month, 2 weeks, right?
Yeah.
If you start at week 8, by the time the dog is 2 months old,
2 months,
you give the first vaccination. DHLPP, distemper, hepatitis, listeriosis. There are just a lot of different diseases just coined in that vaccine.
In
the acronym is DHLPP.
Okay.
Yes.
DHLPP.
Yes. But now this is where the trick comes from. If the mother was vaccinated, yes, you can play around it till week 8.
Okay.
But if the mother was not vaccinated or you're not sure, it's best to start at week 6.
Okay.
So it's given with 2 weeks interval. Each shot, 2 weeks interval. So you give 3 shots. Yes. So you can give, if you start at week 6 now, by week 8, you repeat the second shot. By week 10, you give the last shot. That's, for me, and in most cases, the cases I've handled and the vaccinations I've done, most of them, their mother is actually vaccinated.
Oh, okay.
So I start at week 8.
But it's still the same 3 shots?
Yes, it's 3 shots. By week 8, I give the first shot. Week 10, I give the second shot. Week 12, I give the third shot. By this time, they are 3 months old. That's when they are due for anti-rabies vaccination. At 3 months old. Because when the dog gets to 3 months, that's when the canine teeth actually grows. It becomes fully developed.
Yeah.
You know, so once your dog is 3 months old, that's the time to give that anti-rabies vaccination. Once you do that, the next thing that just follows in between now is you deworm.
Okay.
You deworm them. So some people can even, you deworm just monthly, 3 months. 3 months is, for me, I do 3 months.
Okay.
Every 3 months, you try to deworm your pet. You know, that's a very good health practice.
Is there anything else like the public should know? You know,
medically, the things you need to do to put your pet in a very good, healthy state is to follow through with these vaccinations. So some people start and then they stop along the way, maybe due to lack of funds and all of that, thereby exposing the animals to, you know, they now still become vulnerable. What you're trying to prevent might still happen along the way because that treatment plan was not followed through. And it's very, very important that everything be followed the way it's supposed to be.
We have a closing tradition where you give us one life advice and you write it in our Good Living book.
Okay.
Yeah. So, place that for you.
All right.
Thank
so
you very much.
Am I going to say it out or just write?
No, you're just going to write it.